We're helping you protect your family tonight by finding answers to common questions you may have about monkeypox. Here's a reminder of the monkeypox symptoms. The most obvious is the rash or lesions that can look like pimples or blisters. Fever, headache, swollen lymph nodes, chills, and exhaustion can also be warning signs. I sat down with the chief of infectious diseases at UB today to ask him about transmission rates, vaccines, and any possible spread in schools.
I think we're going to have an increasing number of cases on the short term.
Dr. Thomas Russo talking about the uptick in monkeypox cases across the United States.
We've had now a little over 6,000 cases of monkeypox in the United States. About half of those cases have been in California, New York, and Illinois, the home of the three largest cities in this country.
How transmissible is monkeypox?
Monkeypox is much, much less transmissible than SARS-CoV-2, the cause of COVID. It requires prolonged skin-to-skin contact, which most commonly occurs during sexual activity. However, it can also be transmitted by bed sheets or towels that have been contaminated with individuals that have active lesions, or more prolonged face-to-face contact where respiratory droplets are survived or exchanged by individuals. You do not have to worry about acquiring monkeypox within a grocery store, within a train, subway, or plane. It requires that intimate contact.
There is a vaccine for monkeypox. What do we know about the vaccine at this point?
We have a vaccine that should be able to prevent monkeypox. I think it's fair to say it's been estimated to be about 85% efficacious, but we really don't have any real-world data, and I think we're going to learn more about how effective it is. Having said that, I think vaccination is going to be the secret for getting this outbreak under control.
We're getting ready to go back to school. We're seeing an uptick in cases of monkeypox. What should parents know or be thinking about when kids are heading back to school this fall?
I don't think parents need to be overly concerned with their children heading back to school. They're at very low risk for acquiring this disease, and because transmission requires that prolonged intimate contact, that's unlikely to happen with our children.
Dr. Russo says if you do have any flu-like symptoms or rashes, to reach out to your healthcare provider immediately.